Hi everyone, I'm Sophie Ash from Prospology and I'm here with Hafsa. Sorry Hafsa, I don't actually know your last name. You'll have to introduce yourself in a moment.
No problem.
So today's topic is going to be writing and grammar for ESL medical writers. So Hafsa, if you'd like to just introduce yourself and then we can jump straight in.
Hi, my name is Hafsa Abdirahman. I am a public health scientist and a freelance medical writer. I've also spent the past 7 years teaching English to English language learners.
Amazing. Okay, so I've got the deck up on my screen, so I'm just going to be flicking through the slides as we go. And let me know if you ever need me to go back or if I'm like not showing the right thing. So we've split the presentation up into a few sections. So we've got general advice, I think it's grammar then, and then writing.
Yes.
And so we'll have 20 tips in total. So I'll let you take it away.
Thanks, Sophie. So I want to begin by giving just general advice to medical writers. And these are tips that I found to be helpful really regardless of where you are in the English learning spectrum. So if English is your first language, if it's a language that you've spent most of your education in, whichever it is, I hope that this advice is something that you can take away and benefit from. So my first advice is to immerse yourself in English. I've noticed with my students, those that actually spent their free time, whether it was watching movies, reading books, listening to podcasts, whatever it was, those that actually spent their free time immersing themselves in English inevitably did better. When it came to exams, when it came to writing, their output was always better. So I think that's really the number one tip. Think about something that really interests you and find it in English.
Awesome.
Moving on. This actually follows up on that, and this is to think in English. Sometimes if you think it may be easier to actually write out my paper in my native language, and then I just spend the rest of the time translating it into English. And the reality is that can actually make things a lot more difficult for you. English has a unique way of unique sentence structure that might not be the same as yours. And so you really save a lot of time if you just think about and try to formulate your sentences in English first. Another tip that follows along with this is to really keep up to date with the peer-reviewed articles in your field. What do I mean by this? Well, there's academic English, there's scientific English, there's spoken English. And you can benefit from practicing all three, but you will really help yourself if you focus on your field. Specifically, if you want to write research articles or you're trying to get published, look at what your peers are doing. Read the latest journal articles that are being published by, if you're in cancer biology, read the latest articles in the cancer publications and so forth. This is really going to help you get a feel for what's expected of you when it's your turn to write and publish. And this is actually continuing on with the publications. Specific publications have specific guidelines. And if you want to get accepted, if you want your paper to get accepted, if you're doing a research paper, even if you're doing an online article and you want to get published in a popular website or forum, you have to follow the guidelines. And so the best thing that you can do for yourself is to look at the specific guidelines and follow them. Some guidelines, for example, will be, do they want British English or do they prefer American English? There's going to be different spellings, whichever the case it is. Do they also look at your references? Do they have to be in AMA format, in APA format? So really take the time to get to know the guidelines and to follow them. And this is advice that I used to drill in my students in my writing classes. You may feel that when you write a sentence, you get stuck. You're like, oh no, this doesn't sound right. How do I fix it? Don't worry about fixing it. Finish your writing first. This will save you so much time. Don't focus on grammar mistakes. Just get the writing in. You will have time later to go back and to revise. You should be doing that anyway. So don't waste your time. Write first, edit later. Again, following on this, everybody makes mistakes. Even if English is your first language, you are bound to make mistakes. So I can only imagine that if this is a language that you've learned, writing it is not going to be easy. And that's okay. Making mistakes is perfectly normal. This is how you learn. So do not be disappointed in yourself and do not be afraid of mistakes. This will actually help you to improve and to become a better writer. This is actually something that I have benefited from in my writing as well. And that is to use apps and tools that are available for you to improve your writing. One that I mentioned here is Grammarly. There's also another one called Hemingway, but I don't have much experience using it. Grammarly is an online app that you can, I believe it's a Google Chrome add-on. And so once you install it, it will automatically, as you write, it'll automatically pick out your mistakes. And you'll be able to actually see what mistakes you make. And this actually benefits you because it's kind of like a teacher pointing out what you need to work on. So pay attention to the mistakes that are commonly highlighted. These are the areas that you can work on when you have time. Lastly, for this tip, for general advice, it's hire an editor, get professional help. It's not easy to get your work published. There's a lot of competition out there. So you want to make sure that you put your best work forth. And sometimes that does require hiring an editor. So there are many benefits to hiring an editor. Just to summarize some of them, you get an extra pair of eyes on your work. You're working with a professional who knows how to take your paper to the next level. They have plenty of experience. They've helped others before you. They may even know your specific publication. What are the chances? What chances do you have of getting published and how you can increase those chances? So, and once again, it's a learning opportunity for you. You can learn from the mistakes that your editor highlights, especially the frequent ones. Do you have a problem? Which specific grammar points do you have a problem with, for example? And then take the time to work on that. You can also help to identify your strengths and the areas that you can further expand on. So in this section, we're going to move on to the grammar tips. And for when I was putting this together, I really wanted, grammar is such an extensive topic that I just really wanted to focus on some common grammar mistakes that I found in my experience and in the literature. Your specific mistake, your specific challenges in grammar may be different. And so I really encourage you, before we move on to this, I really just encourage you to take the time, notice what mistakes you have, and then go online and look up practice quizzes and so forth on your specific point. There's so many resources out there, so please take advantage of it. The first one I want to focus on is focus on, again, your common grammar mistakes. So is it using adverbs incorrectly? Is it using filler words, words that are unneeded? Is it specific grammar, present tense, past tense? How do I use the present perfect, for example? So make note of it once again, and then try to work on those mistakes. Here, I'm going to focus on knowing your verbs, specifically subject-verb agreement. What does this mean? Well, in English, if we have a subject that is singular, one person or one thing, then the verb that follows it has to also be singular. And likewise, if the subject of the sentence is plural, then the verb that follows it is written in the plural form as well. Let's look at some examples. In this first sentence here, it reads, the novel coronavirus attacks the respiratory system of the infected individual. Note, the novel coronavirus is singular. Therefore, we add an S at the end of the verb attacks, because in the present form, we add S for the singular form of the verb. Here's a similar sentence. Coronaviruses attack the respiratory system of infected individuals. Here, we're saying coronaviruses, therefore this is plural. We take out the S in attacks and just write attack. Here actually is to continue on into different, not just the subject-verb agreement, but looking at verb tenses as well. There are many verb tenses in English, and there are specific times in which we use each one. Here, I'm just going to really focus on the three main tenses, the simple forms, and focus when you would be using them in your specific writing. So when do we use the present tense? We use it when we're talking about general truths and facts. So here's an example. Heart disease is a leading cause of death in racial and ethnic minorities in the US. This is happening now, and it is also a fact. Therefore, you use the present tense. This would be used, for example, in the introduction portion of your writing, if you're writing a research paper. In the past tense, we use it for discussing matters that have already happened. So, clinicians collected blood samples from trial participants. This is an action that has already taken place. That action has finished in the past. When would you use this in your paper? Usually in the methods section when you're describing something that you have completed, tasks that have been completed. Finally, the future tense is best used when making predictions and suggestions for future improvements. So campaigns on heart disease targeting vulnerable communities will be the object of future research. This is a prediction. This has not happened yet. What part of the paper would you see future tense? Usually towards the end, at the end of your research paper, perhaps at the end of your discussion or in your conclusion, when you want to make suggestions, this would be a time where you can use a future tense, where it would be appropriate. All right, articles. Articles are one of the most challenging grammar topics for non-native English speakers, and it is something that I have found can only improve with a lot of practice. So if you find this challenging, don't worry, you can improve. Just take a lot of online quizzes. There's a lot out there for you to practice on. The key to using articles is to first determine the noun that they come in from. So a noun follows the article. And you have to look at the noun to decide which article you are going to use. So for specific nouns or something unique, we use a definite article, the. The World Health Organization, there's only one, so everyone knows what you're talking about. The World Health Organization is the leading public health institution addressing the coronavirus pandemic. There's a note also that we use the when we discuss something for a second time, and this goes again to specify because we now know what you are talking about. So in the beginning, you can use a, for example, a coronavirus is a virus that attacks the lungs. The specific coronavirus that is now affecting us in 2020 is called COVID-19. So in the second sentence, you are now talking about the specific coronavirus and you're mentioning it for a second time. So you use the. We use a for general nouns. And a is called the indefinite article. So a microorganism that causes disease is known as a pathogen. And it's also the first time that you mention it. So in this case, you use a. Just a quick note, an is used for when you have a vowel. So an atom is the smallest particle that makes up a chemical element, for example. The next tip goes on to talk about pronouns. It's really important that we stay away from using pronouns unless it is very clear in your sentence what the pronoun refers to. In general, in academia, because science seeks to come off as very observational and not personal, there is a debate about whether you should use personal pronouns such as I or we. My advice would be to go back to your specific publication and see what they expect. In some cases, if you're describing a specific procedure that you or your colleague has, performed, then it may be appropriate for you to use the we pronoun. But otherwise, it's generally looked down upon in academia. But this is completely different, of course, for blogs and more informal types of writing. In any case, you still always have to be sure to only use pronouns when the noun they are referring to is very, very clear. So an example here is, after the participant completed the survey and wrote suggestions, it was collected. we don't know what exactly was collected. It's not very clear. So we take the sentence and we try to make it more concise. After the participant completed the survey, it was collected. Here, it's very clear what was collected was the survey. Passive voice. Let's discuss what is the passive voice. A lot of times in writing, especially if you take a lot of writing classes, you'll get the advice to avoid using the passive voice. Do not use the passive voice. It's boring, it's uninteresting, use the active voice. My advice is when it comes to science writing, again, because we're trying to be observational, it is okay to use the passive voice, but only sometimes and not often. Let's look at some examples. First of all, what is the difference between the active voice and the passive voice? The active voice emphasizes the doer of the sentence. So who is the subject? The doer is the subject. Who did this action? If you look at the first sentence, here's an example. Dr. Edward Jenner invented a way to protect against smallpox in 1796. It's very clear who the doer is, Dr. Edward Jenner. He's also the subject of the sentence. When you use the passive voice, what you're doing is actually emphasizing the action and not the person who is doing it or what is causing the action. So you're actually emphasizing the object, the one receiving the action. When is it appropriate to use this? When you want to actually specify the result or the action and not the person doing it. Or when the doer or the subject is unknown. These would be two cases in which you would not use the active voice. Let's look at the sentence. It says the smallpox vaccine was invented in 1796 by Edward Jenner. Here, the emphasis of the sentence is actually on the vaccine and not on Edward Jenner. In fact, you could take out by Edward Jenner and just have a complete sentence. The first smallpox vaccine was invented in 1796 and have a period right there, and that would be a complete sentence. And that would be a complete idea. And so that's when you use the passive voice, when you want to focus on the discovery and not necessarily the person who did it. All right, so here we're talking about using the correct prepositions. There are over 150 prepositions in English, and 70 of them would be what we refer to as commonly used prepositions. So there's lots of them. It can be difficult to keep track of. So let's focus on the general rule. Prepositions usually follow a noun, a pronoun, or a gerund, which is basically a noun form. And they are followed by objects. So here you have a sentence, she suffers from dementia, an object. We studied the effect of mindfulness, object, on anxiety and depression. Some other common prepositions are listed below. Pay attention to how the preposition is used. This is a case where if, for example, you are translating from your native language into English, you could trip up and make a mistake because not all prepositions translate into the same preposition or you would think it translates into when you're looking at English. So this goes back to the first or second advice that I gave in when you're writing, really try to write and think in English first, because this is an area where you can make some mistakes if you try to translate. Okay, moving on to writing tips. This actually goes back also to the general advice earlier about reading peer-reviewed articles in your field. One of the benefits that you get from that is that you get to learn the relevant vocabulary in your field. And so English is a language that's rich with words, and there's so many different ways to express or to convey information. But sometimes you can end up using words in the wrong context. So pay attention to the words that are used in your field. Are there general terms that are used? Perhaps there's a term that in spoken English means one thing, but in a field of psychology or microbiology means something completely different. So you want to make sure that you're on top of that. And again, read publications. That's really the best way. Read publications in your area and your field, your expertise, to really familiarize yourself using the correct words. Moving on. Keep your writing simple and easy to understand. Clear, concise language is easier for your reader to digest. And at the end of the day, that's what you want. You want your reader engaged. You want your reader to understand what they're reading and not to feel confused or bogged down by all the heavy language. And one good question that you can always ask yourself is, okay, am I using too many words? Is there a simpler way to write this? Can I take out some words and still convey the same amount of information? Moving on now to parallel writing structures. So this concerns sometimes when you're in your writing, you may want to link various ideas together. And if it's not done correctly, it can come off as very, very confusing. Let's look at some examples. The data were collected, cleaned, and analyzed. Here you have 3 separate actions that took place with the data. So it's important that you write those all in the same form. So same past tense: collected, cleaned, analyzed. It's consistent, it's easy to understand. Patients were asked to listen to the lecture, discuss the questions, and giving feedback to the researchers. I hope here you can see the confusion. Giving feedback is not in the correct form. And even when you read this out loud, it sounds jarring. You can feel that there's something off. So look back again and look at the forms that you're using in your sentence. Are you using past tense? Are you using the ing form of the verb? Keep it consistent. Participants were asked to listen to the lecture, discuss the questions, and give feedback to the researchers. This continues on, it's a related topic really, and it just goes on to say to improve your sentence structure. What I mean when I say this is that if you have the same form of sentences over and over again, you're repeating over and over again, you can also lose your reader's attention. For example, if you start all your subjects off with I or we, followed by verb, followed by object, it can get repetitive, it can get boring. Switch it up, use varying sentence structures, but make sure always that your subject and your verbs agree, and that try varying lengths, intersperse them, long sentences with shorter sentences. Don't try to write the exact same thing. This is really going to help you with the flow of your paper and the general, cohesion within a paragraph.
Can I just ask a quick question?
Mm-hmm.
Make sure your subjects and verbs agree. I'm not fully sure what that means, so I'm just wondering if you could explain that one a little bit more.
Sure. So if you begin your sentence and you're talking about, for example, patients, and you say patients were given, or patients were asked to listen to the lecture, or patients were asked to take a certain medication, and then halfway through your sentence, you change your verb structure so that now you're saying that, patients were asked to take medication, have received care. The reader is now confused because you're switching between verbs. Did this already happen? Is this continuing to happen? Is this going to happen in the future? So it's just remaining consistent. Another thing also is that you may begin your sentence talking about a plural. So you say patients, but then halfway through your sentence, you end up saying he or she. So these things are not consistent, and that can create confusion. Does that clear it up a bit?
Yeah, thank you.
Mm-hmm.
This point goes across 2 slides just because it didn't fit.
Oh, okay. So this is actually about punctuation. I know it says passive voice, but it's about punctuation.
Okay. I'll fix
just the
that,
title.
don't worry.
No problem. And it just, for this case, I just wanted to focus on the 3 main areas that I found students to struggle with, and that's with the use of commas, semicolons, and colons. Just as a side note, there is some debate over, I don't know if you've heard, over the Oxford comma, and it's just the idea of that in British English, if I'm not mistaken, there's a comma placed right before the word and, whereas in American English that the comma is not placed there. So this goes back again, once again, double check with your publication, see what rules they have concerning commas, semicolons, and colons. We'll just start with commas. We use commas after words and phrases like however, although, despite this. And oftentimes you can notice the comma, even when you're reading, it creates a pause in the sentence. So if you're having a difficult time, read the sentence out loud. Does it sound like there should be a pause there? Then perhaps you should use a comma. So here are some examples. However, we intend on repeating this experiment in a different geographical area to further validate our findings. We use commas between ideas that are incomplete without each other. These are also called dependent clauses. So here you have the findings were statistically insignificant, despite the seemingly high percentages. So you would need to link them together because this is incomplete alone. Despite the seemingly high percentages is incomplete. So you would say the findings were statistically insignificant, comma, despite the seemingly high percentages. Now it's a complete thought, complete idea. We use semicolons between ideas that are not joined by conjunctions like and or but. So the findings were statistically insignificant. Student attendance was not associated with a decrease in bullying. Adding on to that, semicolons are used for two ideas that are called independent clauses, which means they can stand alone. Next slide.
Okay, that's it. That was the final point.
Oh, perfect.
We're done.
I think I just have one more point to add, and that's about colons, because I mentioned that I'll talk about colons.
Yeah.
And this is just really quickly, colons are usually used when we're listing a number of things. And so, for example, you'll have a sentence, well, I'll make it simple. I went grocery shopping, I bought apples, oranges, bananas, and grapes. So you would use a colon before you end up listing what you bought.
Awesome. Thank you so much, Hafsa. I think that was such a great, concise way of covering all the essential components of writing and grammar. And I think it would be really helpful for people to have this guide to refer to. I'm going to tweak a couple of those errors that I spotted as we were going through, just so that people will have an accurate version. But yeah, amazing. Thank you so much.
You're welcome. Thank you for the opportunity. And I really hope that it's beneficial and it helps people.
Yeah, absolutely. And if I'm working with you at the moment, you're watching this, and you're one of our clients, then if you're struggling with your writing and your grammar, let me know, because we can incorporate more support of this nature into your program. And maybe I can connect you with Hafsa, and she can provide you with some additional support.
That would be wonderful.
Okay, thanks again, and we'll keep in touch.
Thank you, Sophie.
Bye.
Bye.